CareConnect's aim is to connect research with policy and practice, so really it's to bridge the gap between the research that academics do and our external partners, and that could include the private sector, voluntary sector and public sector organisations. We offer a range of support to both our academics and to external partners. So for example, we fund events, conferences and policy roundtable discussions, and that really helps academics to disseminate their research findings to the external world. We also offer small pots of seed funding to develop knowledge exchange partnerships between external partners and academics, and one of these has been around sex workers.
Well, the work that I do is with a partnership called Genesis, which is a sex work project in Leeds, and we also work with their national counterparts, so other sex work projects across the country. There was a real need from practitioners to come together to learn about research findings. There was no events that were going on, networks had been depleted, people hadn't got the money to come to events. So I was looking for a pot of money in order to do some knowledge transfer activities. CareConnect were very obliged in terms of thinking how we could bring practitioners into the university. And therefore we approached them to do a knowledge event. The event was very successful because there was a lot of research knowledge at a local level that people were very interested in. We did a needs assessment, we did a local scoping of the needs of sex workers. These instruments and findings were very important. So the event was highly successful in terms of bringing together these networks, but also disseminating important research findings.
We have a scheme called the Academy of Community Research, which has a number of workshops to support research skills and evaluation skills within community sector organisations. We also offer placement and intern opportunities for our undergraduate and postgraduate students. So the students benefit by having work experience and the external organisations benefit with the skills that the students bring in terms of research and evaluation. A key part of our work is to help both academics and external partners develop external research funding bids. An example of this has been our work with Leeds Older People's Forum, where we supported a bid to the Big Lottery Fund, and that enabled them to win £6 million to support provision to older people in the city.
We're a local charity, quite a small charity. We're an umbrella organisation, so we support other charities within Leeds that work with older people. The project that we undertook was around social isolation and loneliness. Andrea brought skills and knowledge that we didn't currently have within the team and within the partnership, so obviously around evaluation and research. Ultimately, the bid was successful, so as a consequence, £6 million has been brought into the city to tackle social isolation and loneliness, and they will support us going forward in evaluating the impact of that project, so be able to see how we've had an impact and where in the city.
As a commissioning manager, my area of responsibility is enterprise development, so that's really around developing the market, making sure that we have a range of different organisations that provide health and social care services in Leeds that people can buy their services from. The project we've been looking for help with, or working with CareConnect on, is around a pilot project that we're running with funding from the Department of Communities and Local Government. So we're working with a third sector organisation who is going to work with social workers to provide support planning and brokerage of care and support services to meet people's needs. CareConnect have been working with us around the evaluation of the pilot, but initial work has very much focused on carrying out a cost-benefit analysis to understand how it works, what sort of information we need to gather and how we populate it. This piece of work is just the start of a period of 12 months of working with CareConnect. So we will be delivering a pilot and then working with CareConnect to evaluate whether that pilot's been successful, whether it's achieved the outcomes that we anticipated, and also doing a follow-up cost-benefit analysis to say what happened, was it as we expected, and actually is there a benefit in terms of financial and also better outcomes for the council in terms of rolling this out to other areas.
CareConnect's been really successful. It's enabled to develop a range of fruitful partnerships between external partners. We've generated a range of research income that's supported external organisations to improve their service delivery. And we've secured a number of internships with external organisations. So really it's been a win-win on both sides. In the future, I see CareConnect as developing more of these good quality partnerships that we've developed already, moving from Leeds to sort of more regionally and nationally, and ensuring that we continue this relationship where both parties benefit.
We would look to further partnership opportunities to work with them again, and obviously I think the fact that we've commissioned them to work with us for 6 years really strongly demonstrates that we were happy with that service.
CareConnect enabled, facilitated this activity, and without them we wouldn't be in a place where we can build on those networks now.
We wouldn't have been able to do this piece of work without CareConnect. Having someone who can give us really good working examples and support us, and also as well as develop the capacity of the team to be able to do this in the future, has been invaluable.